Dr. Josh Cooper,
And I'm Dr. Scott Sattler.
and we are Sound Plastic Surgery located in Seattle, Washington, right next to University Village. One thing we should talk about today are some of the potential complications with the breast augmentation operation. There's both the acute potential risks that could happen at the time or just around the operation, and then there's some more long-term risks.
Yeah. I'll go over the acute ones first. The main issues, not in order of frequency, but just just to relate them, things like bleeding and infection. Those are complications that are inherent in any operation that we do, whether it's plastic surgery or cardiac surgery or even brain surgery. So bleeding and infection are really managed by just paying meticulous attention to bleeding, and also doing a couple of things intraoperatively which we think reduces implant infection, and that is to give the patient a dose of preoperative antibiotic prior to incision, actually during the induction of the anesthetic, and also using some antibiotics postoperatively. And then secondly, washing or bathing both the patient's breast pocket and the implant itself with a triple antibiotic solution. And that's been shown to diminish the low-level contamination around implants and maybe even reduce capsular contracture down the line, which Josh will discuss in a minute. And then I would say, another acute or short-term complication of the operation is just complications from the anesthetic. Younger women who tend to have breast augmentation are more prone to postoperative nausea and vomiting, especially when a general anesthetic is used. And so we always prescribe some medications like Zofran, which is also called Odancitron, or a scopolamine patch for patients to use perioperatively, and that really helps manage post-op nausea. Our anesthesiology providers or anesthesia providers are acutely aware of this problem amongst young women and do some things intraoperatively to also reduce the incidence of post-op nausea and vomiting. But Josh, what are more of the kind of mid-term and short-term and long-term complications?
So two of the main complications that we always discuss with our patients are breast implant leak or rupture, and also capsular contracture. So over the course of your lifetime, there's always the chance that silicone implant could leak, and we usually quote that the chance of that's about 1% per year. And with the new models of silicone implants, there is less likelihood of leakage, I would say, than some of the older implants. The other big complication that is possible, although not that common, is a capsular contracture. And what that refers to is the capsule that forms around your breast implant. Whenever we place an implant in a patient's body, your body's natural response is to make scar tissue around that, called the capsule. But sometimes that becomes abnormally thickened and hard, and then we term that a capsular contracture. Sometimes it can be so hard that it's painful. It can distort the shape of the breast. If that happens, we can go back through the same incision through which the implant was placed, and we can remove that scar tissue and replace the implant. We think there's probably a little less likelihood of capsular contractures with the newer implants, and also placing that implant underneath the muscle, which we do in most cases.